have an opportunity for a question and answer session. Do I have any questions? Yes.
Will it cause problems if the patient's cuff deflates?
The cuff on the trach itself is a little balloon that is blown up around the trach. There are some trachs where a cuff is used to hold it in place. The majority have the cuff on that we can blow that cuff up when the person is eating, and that cuff then occludes the area around the trach itself in the trach so that we can not have aspiration of food and or fluids when that person is eating. The important part of that is, however, to deflate the cuff when the patient is not eating, otherwise it will cause an erosion of the trachea. And this is the little balloon that is held on the outside. If that's blown up, it means that the trach is inflated, that cuff is inflated, and when it's not blown up, which this one is not, that cuff is deflated and not causing erosion. Any other questions?
How often should you perform trach care?
That's a really good question, and this can be dependent upon the policy at your facility or upon what is needed by your patient, because not all of these have a lot of drainage. Generally, we'll change this and clean it once every 24 hours. Clients at home may not even clean it that much if it's not needed. If it's once every 24 hours or once every shift maybe, but we would certainly want to clean this trach as often as was needed, so we'll have a PRN order if we have someone who has a lot of secretions and this needs cleaning more frequently. That's a good question.
What's the purpose of the passing MER valve?
Oh my goodness, I'm glad that you're aware of the passing MER valve. The passing MER valve was created. It is an appliance. Actually, it's almost like a little round disc that's placed right in the trach. And this allows persons with trachs to speak because it allows breathing through the trach, but it also allows air to pass over the vocal cords so that persons can speak when they have that passing MER valve in place. Because, as you know, when we put a trach in and we have air coming out of the trach, air is not moving over the vocal cords, and that's why people can't speak. Any other questions?
Yeah. Can you only lubricate the suction catheter with normal saline?
We use normal saline. I like that you're thinking these things through. We use normal saline because it's isotonic with our body fluids, so it's not going to pull fluid into the interstitial spaces, and the cells are not going to pull fluid from the interstitial spaces. So normal saline, because it's isotonic with our body fluids, because it is an isotonic solution, is our solution of choice. Thank you for that question.
What kind of rescue equipment do we need at the bedside of a trach patient?
We would probably want to have an ambu bag there that if we would have a respiratory arrest, we would breathe for that patient. Did that answer your question?
Yes, it did.
What if you start to suction out blood?
If I start to suction blood, it's going to depend upon the amount. So if I have a patient that is coughing and I'm envisioning in my mind that there's some irritation from the coughing in the trachea and it's very small traces of blood, I probably will continue suctioning to open that airway. If it's a large amount of bright red blood, I probably have an ulceration in the trachea and I'm going to stop suctioning and let the physician know right away. We're in a bit of an emergency situation depending upon the amount of blood.
What is the purpose of the obturator?
Ooh, you've been reading. We have an obturator that is, when these trachs come out of the package in this, wherever the surgery is being performed, because the trachs are inserted in a sterile surgical area, hopefully. If not, it's an emergency situation. But in an operating room, when these are inserted, when these trachs are taken out of the package, they will have a closed tube that goes down through the center of the trachea. and it goes all the way through the trachea and has a rounded end on it, so that when the physician does insert that trach, the trach itself, the round end, won't damage the trachea. That obturator end is going to help the trach go down and not cause damage to the trachea. Once the trach is in, that obturator is removed. Okay, one more. Is this the last one, or are there more?
Can the skin around the stoma break down and cause problems for the patient?
Absolutely. There's a lot of drainage, you will have breakdown of skin. So then we probably will use some type of water-soluble protection of the skin around. If there's infection, we're probably going to be using an anti-infective. We would need to assess that, describe it, report it to the physician. We may be suggesting the treatment to the physician because we're there, we're seeing what's going on, and we know the skin treatments. Did you have any other ideas about that?
No, I think that's it.
Okay. Anything else? You've challenged me. Thank you very much.